Dr. Christopher Barker, and welcome back to Holding Space. Or if this is your first time here, welcome to Holding Space. I want to talk to you today about something that's a little bit unusual and a little bit controversial, but this is based on my practice and my experience, and you may not necessarily agree, but I would welcome a dialogue about it if you want to have one. Please feel free to make comments or send me an email. The email is attached to the video. I want to talk to you about spectrums. We talk about people being on the spectrum, and usually what that's referring to is the autism spectrum. And we're talking about something that used to be called Asperger's syndrome, and now it's just seen as like the more statistically normal end of behavior spectrum, and towards the further end is what we would consider full-blown autism. That is not the only type of disorder that has a spectrum, and I think if we broaden our horizons a little bit and our viewpoint, we can look at a variety of different disorders and behaviors as being on the spectrum. What's normal and what's not. This, I think, is at the core of most of the reasons why people would seek therapy, is trying to figure out if what they're doing is considered appropriate and normal, or if it's considered to be abnormal or malproductive or sick, for lack of a better word. These are terms that other people use, but what it really means is your behavior statistically in keeping with what other people do, or is it something that's creating a problem in living? And the problem in living part is the acid test of what is considered a disorder. Are you having enough problems with what's going on in your life that it is creating a hindrance to having a productive life? So if we look at the autism spectrum to start off with, towards the more normal, again, statistical end of behavior, you would see some things like obsession with details, difficulty with stimulation. You find some things difficult to live with because they're too bright, too loud, too scratchy. There's a lot of tactile stuff that goes on. Also, a sort of a disconnection between you and other people. I've had some people who are on the close end of the spectrum say things like, I don't see a need for a relationship. I don't see why people do that. And it's a total lack of understanding about why people would even try to have a romantic relationship with anybody or anything more than friendship. They can have friendships, and they can have some fairly close friendships within certain parameters. The parameters are that, anything that involves thinking of someone as something more than just a person that they can interact with on a social basis is difficult. And frequently other things that are seen on the closer end of the autism spectrum are fascination with certain things. I was once seeing a girl who knew everything there was to know about a particular band from the 90s. And she knew everything. I mean, everything. To the point of what kind of shirts they wore on the days that they were recording. And it's almost like she had been there for their entire career and was able to describe everything, all the song lyrics. You'll also see people on that end of the spectrum with what I would call higher than average intelligence and a better fascination with details, a better ability to recall details, and sometimes a real hard-headedness about seeing things differently. If you were to say, for instance, no, they didn't record that album that year, you would get a fight. You would get a real fight on your hands about that. She would say, no, I know when it was recorded, I know what time it was recorded, I know what day it was recorded. She would also do things like say, oh, we had to watch this film in school today and it was really boring. It was so long. I said, well, how long was it? Thinking it's an hour. She said it was 19 minutes and 34 seconds. And again, just rattled that off because that was the kind of attention to detail that she would have. Again, these are things that don't necessarily make life difficult or impossible to live, but it certainly can put you at odds with other people, and people are going to perhaps look at you a little differently and think that there's something a little off. Understanding this and navigating this and finding out what you can live with and how you can change, if you want to change these things, is something that therapists can help with. Other things that might be seen as being on a spectrum, bipolar disorder. We typically think of type 1 and type 2. If I had my whiteboard with me, which I really should put behind me for these things, Bipolar disorder type 1 is usually seen as a long period of depression that sinks down way below what we would consider the baseline. And you could spend a week in bed and just not able to get up or move around. Then gradually you start feeling better, and then better, and so much better. And then your speech is more rapid. You are able to do more things. You're able to get out all the time. You don't feel any need to sleep. You probably don't find a need for clothing in extreme cases, and sometimes people do outrageous things like write checks for $1 million for their favorite political party because they believe that they are the ones who are going to be able to change the course of history. And sometimes the beliefs are delusional. Sometimes they're what we would call paranoid. Somebody's out to get them, or I know that you don't really care about me, and they will fight you. That is what is usually seen as being type 1, or used to be called manic depressive disorder. You'll still see it called manic depression. You'll still see it called bipolar depression. Those are incorrect. It's type 1 bipolar disorder. Type 2 bipolar disorder, by contrast, is a little more spiky in terms of the way that the curve goes. You'll have long periods of more or less normal and some periods of depression, and then you'll have a sudden spike of anger or a sudden spike of mania that dips back down again, and it can be followed by a rapid crash into depression or into this normal baseline of behavior. It's frequently accompanied by angry outbursts, and I've seen some people who will get into outrageous fights over seemingly nothing that would be upsetting to you or me, but to them, it's terribly upsetting. And once knew a case of a girl who she got into an argument over an intellectual topic with some of her coworkers, and it got to the point that she started screaming and throwing things. And I mean, it was a really intellectual topic, but had to be dragged out by security, and it was kind of like everybody was left going, what in the world was that all about? Why was she so upset? She has a chemical imbalance. That is type 2. There's also childhood onset bipolar disorder. My son doesn't mind me telling people that he has childhood onset bipolar disorder. We saw this at the age of 3. A lot of people will say you can't, but you can. I've seen it in kids as young as 2. And this is, I guess the best way to conceptualize this is an exaggeration of all feelings. There is an exaggeration of sadness. There is an exaggeration of happiness. Frequently, they're more intelligent than the average kid. Frequently, they are more creative than the average kid. And they will start on a story about something, and it will get bigger, and it will get bigger, and they absolutely positively believe every single word of it, and it just becomes huge. My son would say things, and he's a very personable person, and he's a very likable person, and it's very easy to believe most of the things that he would say, but he would start on the story, like for instance, he told his guidance counselor at school that over the summer he had been to a special camp during the summer that the Army hosted, and he'd gotten to do all the Army activities, and they thought it was just amazing that he had done this. And I'm sitting there going, that didn't happen. Sorry, but... And they said, oh. And yeah, that was one of his stories again. Again, not a lie. He believed every single word of it when he was telling it. In retrospect, he realized, yeah, okay, I just went too far with that story, but, again. And why do I call this part of the spectrum? Because when you're dealing with something like childhood onset bipolar, and there are several good books out there about it if you want to do some research. I mean, but this is a podcast. It's only going to give you just so much information. But you can find that there's a huge variability of symptoms and a lot of combination of symptoms of both type 1 and type 2 bipolar disorder that you see with childhood onset bipolar. And it frequently, if it's caught early enough, doesn't progress to anything more severe. It can progress into a full-blown type 1 bipolar. It can probably progress into a full-blown type 2 bipolar. I have not seen that. I have seen it progress into type 1. But again, if it's caught early enough, if medication is administered early enough, then, and because it is a biological disorder, medication really is necessary. It's not something that is treatable strictly through behavioral means. You wouldn't try to treat diabetes by just cutting out sugar. You're going to, if you have the type that it's inborn, you're going to need insulin treatment for that. I am not an MD. However, I do know when to make a referral to an MD, and this would be one of those times. There are a number of behaviors. We talk about borderline personality disorder, and there's a huge spectrum of behaviors on borderline personality disorder also. And I'm going to do a whole episode about that at some point. But there is something called relational borderline symptoms, and that is something that can come out when your of support and relationship is threatened. People will exhibit some rather extreme fluctuations of mood and behavior and things that might be diagnosed as a full-blown personality disorder. But it's really just because they have lost their footing. And we've talked about how severe trauma can manifest, and usually relational trauma can result in this type of desperate behavior. People will abandon friendships, they will do parasuicidal behaviors, they will have explosive temper outbursts, but this is in relation to a failure of a relationship. We also there's a huge variation of spectrum on different types of sexual behavior, and I will talk about that in more detail in a future podcast because I think it's something that deserves its own episode. But I am a member of a group called Kink-Aware Professionals. We have experience with, I guess it would be called alternative lifestyles, people who have various paraphilias, which are fixations with unusual objects or behaviors, and they lead to sexual gratification. People who have a foot fetish. People who have a fetish for... I've seen a huge list, and some of the things that people become fixated on is absolutely... I have no idea how it got there, but it usually is the same as we were talking about the development of a phobia. Arousal became paired with a seemingly innocuous event or object, and that became an object of stimulation. We have people who are into bondage and discipline. We have people who are into severely what might seem extreme dominant submissive relationships, but as long as both parties are consenting, it's not dangerous. It has to be consensual. It has to be safe. Nobody should be hurt beyond how much they wish to endure pain. And there is a certain amount of fascination with pain that occurs with some of these. Again, that will be a whole episode unto itself. But all I wanted to do at this point is to give you some idea of a few things that can be seen as being existing on the spectrum. It's not just one thing or the other thing, and it's not just off or on. Sometimes it is a matter of degree. Send me some ideas of things that you would like to see discussed as being spectrum or not spectrum behaviors, and we can discuss that. Gender identity also exists on a spectrum. This is very controversial. There are a lot of people who would say that that is not the case. But gender identity is something that a lot of people have on the spectrum. And I've seen that drawn out really in an interesting way by one of my patients who said there's typically male behavior that exists at this end of the spectrum. There's typically female behavior that exists at this end of the spectrum. And in the meantime, there's variations. Again, for a future episode. But thank you for tuning in, and I will see you next time. Holding space for you, hold space for me. Thank you.